Is AI eventually going to be able to cure your scoliosis? Well, I don't really know about that, but today I wanted to share 3 ways that AI is currently changing how we treat scoliosis. Okay, so over the past, I don't know, what has it been? 3 years, 4 years, we've been seeing AI changes in a lot of our professions and a lot of what we do in our lives. We've been hearing a lot about AI. Over the last 2 years, with being a member of SOSORT and the International Conservative Scoliosis Community, it's been interesting to see that we're seeing AI research, AI being incorporated into research and incorporated into treatment more and more. And some of those aren't mainstream yet, but some of them actually have become a little more mainstream. And so I wanted to talk about 3 of those that are currently being used and are currently changing how we treat scoliosis. There's some cool stuff on the horizon. We're not going to get into stuff that is probably further out, but we're going to talk about things that are currently available. They may not be available right where you are, but in the world, these treatments and these adjuncts to treatment are definitely available. So we're going to go over those 3. You definitely want to listen to number 3. Number 3 is something that we've been using in the clinic for a while. Well, not for a while. We've been using it the last 6 months, and we're going to start ramping that up. So number one is that something that I'm seeing with 3D printed braces, which I'm really excited about. I really can't wait for 3D printed braces to come more mainstream and to come more to the US. I don't know that there's a ton being done right now in the US, but 3D printed braces, the cool thing about that is the AI modeling that's coming along with those. So let me give you an example. So right now what happens is either the scoliosis patient is scanned with a 3D scanner, and then that is sent off to be fabricated. That brace is sent off to be fabricated, and then it comes back, and the orthotist will use that mold and modify it with pads and things like that. Or the person is casted or some other way of getting a mold of their thorax, and then the brace is made specific to them. And that's a lot better than it used to be. The process goes a lot easier than it used to, but it's still basically a prefabricated brace that is fit to them, and it's not as custom as it could be. So the last 2 years when I've been at SOSORT conferences, especially this last one in Croatia, there were companies that were talking about 3D printed braces and how they use an X-ray with a 3D scan of the person to have an artificial intelligence model what the brace should look like and what it should where it should push and where it should do its 3-dimensional correction. And so the process becomes a little cleaner, where the person is scanned, a 3D scan is taken of the person, the X-ray of their spine is taken along with that and fed into an AI model that then creates what the 3D printed brace should look like, and that 3D printed brace is sent to the printer, and that brace is printed on the 3D printer. And one thing that was really cool was seeing these braces in person in Croatia, and seeing these braces on patients was really actually pretty eye-opening to what can be done with a 3D printer and a brace. So ideally, having a lot more data with these 3D printed braces and the AI modeling, we can improve the effectiveness of the brace. But the other cool thing is with these 3D printed braces, they can create more openings where it doesn't need structural integrity. It can create little dots of space and little openings for ventilation so these aren't as hot. But it can also allow for more flexibility in some areas and less flexibility in other areas. That's something that we haven't been able to do with traditional bracing because the brace is all of one thickness of plastic, and it can't be adjusted specific to the individual other than with the pads and where it's pushed in or pushed out. So with a 3D printer, they can actually print it in a way that there is more structural integrity where it needs it, and less where it's not as solid and it has more opening where it doesn't need that structural integrity. So that was a long way of getting to that they are much more specific to the patient. They are much more comfortable. They have more ventilation. And with the AI modeling, I think we'll see improvements in effectiveness as well, because we'll be able to feed data into that, and it's less an art form and becomes more science. And so I'm really excited about that. So that's the first way that I see AI is currently changing how we treat scoliosis. Again, that's not available for most people. If you live in Croatia and Europe, it's a little bit closer for you. And I think in the US, I'll have to look this up and see if there's anyone doing 3D printed braces in the US. But I would anticipate in the next 2 years that we'll see this become way more standard. And I'm excited for that. I think it's going to be great. The second way that AI is currently changing how we treat scoliosis is something that I haven't seen a ton of yet, but I expect this to happen in the next year, and that's X-ray measurements of Cobb angles. This is something that hasn't really been a struggle in scoliosis treatment, but when one person measures an X-ray and then someone else measures an X-ray, they could have a difference of 3 to 5 degrees on the Cobb angle. So when we are looking at someone who has repeat X-rays, we don't usually say there's been progression of the curve unless that curve has progressed more than 3 degrees, or sometimes more than 5 degrees. So there's that error rate. What that means is if you have a curve that's 20 degrees, that curve could actually be 17 degrees, or that curve could be 23 degrees. And if you're thinking about 5-degree error rates, it could be 15 or it could be 25. That's quite a big difference in the Cobb angle, and that changes what we would do for it. So for example, if someone has a Cobb angle that's measured at 23 degrees, they could be, and we're considering bracing at 25 degrees, they could have a 26-degree curve, and it was just a little bit of an error on measurement. And that changes from not doing bracing to doing bracing. So, some of these cutoffs, the 25-degree cutoff isn't necessarily exact. It's not, but it's also not an arbitrary number. So with AI measurements of X-rays, we will be able to get more accurate and more consistent values for Cobb angles. We'll be able to monitor scoliosis curves better, and we'll be able to detect progression better as well. And I think this is something that's happening a lot in the whole radiology field. AI modeling is changing the way that X-rays and MRIs are read, and a lot of times, a computer an AI can read an X-ray more accurately. They're finding that that's picking up on different things in radiology easier and more consistently than a human is. So is this a bad thing? No, I don't think this is a bad thing at all. I think this is something that will help us to get better measurements of the Cobb angle. And we already have an error rate with human measurement. And if we can automate this and have a known error rate and maybe get that down to 1 or 2 degrees, that would be fantastic. And then we can make better decisions based on the Cobb angle and what we're seeing in the X-ray. So I think that's going to be a good change with AI. I don't know that there's a ton of organizations using AI to measure X-rays, but I do know that online I'm seeing more and more apps or online-based things that you can throw an X-ray in and it will give you a Cobb measurement. I think this does need to be standardized and this does need to be studied. And so it's not something that I really advocate for you to go online and find some random program that you can throw your x-ray in. But I think this is coming, and it will be the standard of care probably within the next 2 years. So that's a prediction. Who knows if I'm accurate with that. So the last way that AI is currently changing how we treat scoliosis, and I mean this, us at Align Therapy treating scoliosis, is having a way to monitor scoliosis curves remotely. So over the past year, we've been playing around with the Momentum Spine app. I'll put a link for it in the description. The Momentum Spine app is an app that you use the camera on your phone to scan your back, your child's back, whoever's back, and then after you scan their back, it goes into an AI prediction model where it predicts what the Cobb angle is based on the topography of the back. So this is pretty cool. This is topography is something that we've had in the clinic for the last 11 years. I've been doing surface topography with my patients to monitor their curve without radiation for the last 11 years, and it's been awesome. I love being able to use topography to see what's going on. But the limitation of that is that it's an expensive machine, and it's only at the clinic, so the patients that I see that live further away, we're not able to monitor their curve as frequently. So the Momentum Spine app, the way that that's going to change how we monitor curves is, scoliosis unfortunately is not something that goes away within 3 months like an ankle sprain or something like that. So a lot of my patients are being seen for a long time, and we're monitoring their curve for a long time. Because of that, sometimes we have to have them come into the clinic more frequently, or sometimes we are missing progression of their curve because of the intervals that we need to do for monitoring, like every 3 months or every 6 months. So with having an app that can model the spine and model what the Cobb angle is, using artificial intelligence is pretty cool. It's a great way for me to monitor those curves remotely. And so I'm really excited about that. We've been using it on some of our patients for a little while now, and we are going to be rolling that out to pretty much all of the patients who come to Align Therapy in Lehigh or St. George, where they will be able to monitor their spine, take scans of their back on a monthly basis, and the AI modeling will predict what their Cobb angle is and predict whether it's improving or whether it's getting worse. And then if it's getting worse, we can do something about it, rather than waiting 6 months for another x-ray or waiting 3 months for another scan. And the AI modeling of those Cobb angles, I think it's pretty good. It can detect progression. It can detect changes in the spine pretty well. But I think it's going to get even more accurate with predicting what the Cobb angle actually is as it's fed more data. And I think that's going to be a really cool way to monitor for scoliosis curves. I've been seeing in the research and in the conferences that I go to some discussion and examples of how people are using ultrasound and using things like that to monitor the scoliosis curve and monitor the Cobb angle, and even monitor growth with Risser scores and stuff like that with ultrasound. And I think that's great that we're looking at different ways to monitor for progression and monitor the Cobb angle without doing an x-ray. But I do feel like surface topography, I've been using it for 11 years now. I think that is really the way that we will be able to monitor curves without exposure to radiation, without repeat x-rays, things like that. And I'm really excited about this. I'm excited to roll this out with my patients, and I'm excited to have them monitor their curves, and when we're seeing progression, that we can reach out and help them to make the changes to reduce that progression. And when they're seeing changes that are good, that they will be encouraged, and we can encourage them to continue with those things, because without feedback, we don't know if what we're doing is working a lot of times. And so this surface topography definitely can help us with getting feedback for what we're doing and for monitoring and for peace of mind. I mean, I have a lot of patients and their parents are worried that their curve is getting worse. And now we have something that they're scanning every month, and they can see and we can see if the curve is actually getting worse or if it's just staying the same or if it's even getting better. So I'm really excited about this. You can probably tell I'm really excited about this. But estimating the Cobb angle with the momentum spine app, that's something that artificial intelligence is doing well now, and we are currently using at my clinic. So that's pretty cool. I think as time goes on, just like every industry and every profession, we're going to see more use of artificial intelligence and AI modeling for different things. I mean, heck, I use AI on a daily basis to help me with business-related things, clinic-related things, for content, things like that. And I think the medical profession as a whole is going to see changes with artificial intelligence. And I think this isn't something to be feared. This isn't something to be resistant to. I think if it improves the way that we treat and we get better outcomes, I think we should embrace this. And I've seen that the ways that we're using AI in my clinic, they've been great. And I haven't seen any issues with that thus far. Sure, it may not be 100% accurate right now on monitoring the curve and things like that, but it's getting better and better. I mean, heck, people aren't 100% accurate in monitoring the curve either. So a quick recap. The 3 ways that I'm seeing AI currently change how we treat scoliosis. Number 1 is spine modeling for 3D printed braces, and I really hope that that is something that we can utilize as standard of care in the near future. Number 2, X-ray measurements. That will make them more accurate, and we'll be able to make decisions better based on the accuracy of that. And number 3, seeing AI estimated Cobb angles with the Momentum Spine app. I'm really excited about that. So I'm sure there are going to be a lot more changes with AI and scoliosis, but these are the 3 that I'm seeing currently and that I'm excited about. So check out in the description. I'll put some links to the things that I'm talking about. And thank you for listening. And I'm excited for the future of scoliosis treatment. And we'll see you next time.